Come in.
Hi, Betty. I'm Dr. Kennett. How are you?
Nice to meet you.
Good. Can I sit down here with you for a few
Yes.
minutes here? I want to thank you for taking the time to come over here to the office today here. Wanted to get back with you here based on your attack that you had of asthma when you came into the emergency room. Afterwards, they had done a bunch of treatments and came up with some interesting results here, and I kind of wanted to go over those with you here and then possibly explain to you how we want to go forward here with it. Okay, is that all right with you? When you came in to the hospital, I was looking through the admittance records here. Had you been a smoker? And for about how many years?
Oh, about 5.
About 5 years? Okay. Anybody else in your family smoke?
No.
Okay, just you?
Me.
Okay, how many packs a day you think?
Half.
About half a pack a day? Okay. Where did you work at, or do you work right now?
Firestone.
At Firestone. What do you do there? The assembly line, or?
It's like an assembly line. I put rubber parts into the press,
Okay.
and it cooks them.
Oh, it cooks them.
Yeah.
Does it get hot in
It
there?
gets really hot.
Phew, I bet. What kind of breaks do you get? Or do you get any
Every
breaks?
2 hours, 15 minutes.
Interesting. When you're on the line there, do you use any breathing apparatuses or anything like that? Are they required, or they're not required
They're not
for that?
required.
Okay. All right. When you came in, you were complaining of shortness of breath, difficulty in breathing in general, and there was some nasal flaring going on. It's like you just couldn't catch your breath. How do you feel now?
Oh, I feel a lot better.
Very good. Okay. All right. The chest x-rays, I don't know if you're familiar with asthma, but you indicated that there was only one other person in your family that had asthma, and it was a relative, like an uncle, I think. The chest x-rays that came back kind of indicate something along the lines of asthma, but we just don't know how severe it is, okay? Taking a look at this particular x-ray right here, if you'll notice the roundness and the kind of the expansion of the chest areas a little bit, especially on the sides, indicate like a barrel chest type of look to you. What that is your lungs have been inflated and they can't really exhale. So it's retaining a lot more oxygen, a lot more air in them, a lot more gas is what we call it in there, than we are expelling here. And because of that, there are darkened areas, considerable darkened areas right there. Normally you'd be able to see ribs going across there, and you can't, and that's because the lungs are pressed up against the walls because they're so expanded. That's a telltale sign of someone with either a respiratory disease or with asthma, and in your case here, based on your records here, you've not indicated that you've had any type of respiratory disorders before. You don't take any type of respiratory medications at home at this point in time? No. Okay, all right. From the aspect of asthma, what do you know about it? Very much, or very little about it?
Oh, a little.
Okay. Asthma is pretty much described as a lung disorder characterized by reversible bronchial airway, smooth muscles contracting, airway inflammation, which makes holes for breathing shrink, and then increased airway responsiveness to assorted stimuli, which leads me back to the occupation that you were in. There are two types of asthma that are probably prevalent, and one of them is intrinsic and the other one is extrinsic. The intrinsic kind is the non-allergenic kind. Hang on there a minute. In other words, if you have an asthmatic episode, there is no set defined thing that would have caused it. It would be pretty much unknown whether it was a trigger of some kind that we're not aware of. We just simply don't know what that is. But something made your lungs tighten up and made you start having difficulty breathing. Extrinsic is an allergic type of asthma. And this appears to be the road that we're going down with you. The episodes are caused, and we can actually define them as something that you breathed in. Maybe it was pet dander, dust from cleaning somewhere, or maybe in your case, chemicals that you inhaled, maybe from your job. I don't know that for a fact, but probably without putting a mask on while you're doing it, you are probably more susceptible to something like that. Some of the high-risk environments for this occupational asthma are farming and agriculture, painting, spray painting, people who do painting jobs and that sort of stuff, janitorial and cleaning supplies, anybody that's in that field, and plastics or manufacturing like you're in. And interestingly enough, that it's predominantly seen in adults, and usually 1 in 10 usually contract this type of situation over a period of time when you're working in the occupations that you might be working in at this point in time. Do you have any questions about that? Can you think of anything, you know?
Well, why would it just all of a sudden start up?
That's a good question. The information that we have on occupational asthma is such that you have antibodies. They're called, for the sake of telling you what the technical term is, they're IgE, serum level antibodies. And these antibodies act like little soldiers, and whenever you inhale something or ingest something that affects your lungs or your breathing, then the brain sends a signal to the respiratory area, which kicks out these antibiotics out of the lymph nodes. And they come rushing to the site to where the problem is, and they try to fix it. And they will decimate whatever's there that's in the way. Unfortunately, when they try to decimate the bad things, they also take the good things. When that happens, it causes inflammation. And you already are inflamed down there because of this foreign object or these foreign things that are in there. All it does is exacerbate the problem. In the case of an occupational asthma, a lot of times these antibodies can lie dormant in a latency period of time for months or for years until they finally wake up and just start rushing to the place. And that's when you have an asthmatic episode. And that appears to be what the case is. I'm not going to say that's for certain, but that appears to be where we're going with this, okay? So, and again, sometimes it just takes a lot longer for other people to get it than others. And in your case here, if you worked there for 10 years, maybe it has taken that long for your system to finally say enough is enough. And that's what we're doing here. Does that explain anything any further, any better to you there?
Yes, it does.
Super. I have taken the liberty to ask Rakeev from Asthma Education to come in and sit down with you, review the asthma situation, explain to you some things about it, and then also to have Wendy from Respiratory come in and to talk to you about a particular device that we will use to help us determine the severity of your asthma. So if you don't mind, Reki, you can come in and go ahead and take over from here.
Hi, Betty.
Hi.
I'm Rakhi.
Nice to meet you.
Nice to meet you too. I'm an asthma educator, and I'm going to tell you a few things about asthma, what it does, and how you can prevent it.
Okay.
What asthma is, it is a chronic lung disease, but it is reversible, so we don't need to worry about it. What happens when your asthma attacks is we have, in our lungs there are branches like tree, and there is a trunk, like a tree. There is a trunk that goes from here and it narrows down. I mean, there are branches in your lungs. And those narrows down when they go down. So when it gets inflamed or when you have asthma attack, we have, this is just one piece of a branch. And what happens is, it looks like this. It has a big circle in between. These are the smooth muscles around it, and they are all nice and relaxed. And we have a big opening for the air to move in and out for a good gas exchange. So you breathe in oxygen, you take out carbon dioxide. And we have a nice room for all that. But when asthma happens, it all gets inflamed around from the smooth muscles as well as from inside. From inside, the mucus builds up and also the smooth muscles tighten up. And from outside, all these vessels and the muscle, all gets thick. So we need to make sure what triggers that. So the common triggers of asthma is smoke, chemical fumes, and like the doctor told you, that chemical fumes are the one that we suspect has triggered your asthma. But you still need to watch for some other triggers that are cigarette smoke. If you are smoking, you need to think about quitting it, because that is going to make asthma worse. And allergies to animals' fur, cockroaches, dust in carpets, beds, pillows, any strong perfumes or sprays you use. Cold weather can trigger asthma, and rainy days, pollen, trees, flowers. So we need to watch for all those triggers, and we need to make sure that when you have asthma episode, around the other circumstances, you keep an eye on it and let the doctor know what other triggered it. Right now, occupational is the one you were diagnosed for, but these are the ones you need to watch for.
Okay.
Do you have any questions on the triggers?
No.
Okay. Then we'll go ahead and I'll show you what exactly happens in asthma and what we are going to do for it. So there are 3 processes that goes when asthma triggers. The first one is tightening of muscles in the airways, and like I told you before, it makes your airways very narrow and makes it difficult for you to breathe. And mucus is produced, and mucus goes into our airways and makes it smaller, our airways smaller. So all this is mucus buildup, and now you don't have, it keeps on going smaller and smaller, so you don't have enough air to move in and out. And inflammation, what happens is this lining gets inflamed and the outside lining gets inflamed. So we need to make sure that all that is opened up. And the treatments we can do for those is a bronchodilator and a steroidal medicine. And doctor is going to give you those and talk to you about those more, but I'm going to tell you what bronchodilator does. Bronchodilator, it decreases the inflammation of the airways by working on your smooth muscles. And steroid is also anti-inflammatory. It works on your inflammation. And he's going to prescribe those to you, and you need to take those. And Wendy, she's going to tell us about how to use your peak flow. Peak flow is a device which you need to use to monitor your asthma, and when you use it for a certain time and the doctor can see it, then he can change the medicines accordingly for you. So you need to use it and make sure that you know when your asthma triggers. Okay?
Okay.
So thank you.
Nice
to meet you, Betty. And if you have any questions, let us know. And I'm going to leave you these pamphlets to look on it later on when you have more time.
Okay.
And let us know there is a number you can call on there, and we'll explain you more about it.
All right. Thank you.
Thank you.
Hi, Betty.
Hi.
My name is Wendy. I'm a respiratory therapist, and the doctors let me know that you have been diagnosed with asthma, correct?
Correct.
And that we need to show you how to use the peak flow meter. Have you seen one of these before?
No.
Okay. So what this does, it kind of helps monitor the severity of your asthma, so we know when to take medicine, when to increase your medicine, and when to go straight to the hospital. And so with this, there are 3 different levels. We're going to chart your best. Then once we find your best, we'll know where you're at on the flow meter. There's the green, yellow, and the red. When you're in the green, that means you're fine. Don't need to take any medicine today. You're in the yellow, caution. You need to take your inhaler. 20 minutes after that, blow again. If you're in the green, you're good. If you're in the yellow again, take your medicine again. Wait 20 more minutes, and you may need to call your doctor and let him know that you're having to increase your medicine to get relief. If you blow and you're in the red, immediately take your medicine. If you don't feel any relief within like the first 10 minutes, take your medicine again, go straight to the emergency room, or call your doctor depending on the severity of your condition. You don't want to mess around a lot when you're in the red, but you want to make sure the very first thing you do is take your medicine. So today I'm going to teach you how to use this, and we're going to track how you do on this for the next 2 weeks, because Can I ask your age and your height?
61, and I'm 5'4".
Okay. So according to the manufacturer's predicted peak flow, you should be around 430. So we've got this set here for 430. This is what they think you should be able to do. But we're going to track what you actually do, asthma-free, without symptoms. So what we're going to do, I'm going to show you how to use this. You're going to do it 3 times. You're going to take your best number and you're going to write it down. We're going to do this for 2 weeks so we can get your best number so we know where you're at. And you want to take this chart to your doctor with you when you go back for your checkup visit. That way they can kind of know when you need, what your trends are, and what kind of medicine you need. So, to use the peak flow meter, there's a little yellow dial down here. We want it to always be at the bottom when we start out. You're going to sit up straight, and you want to do this at the same time every day if possible. Sit up straight as you can. Big deep breath in, fill your lungs full of air. Hold it for a second. You're going to have this right next to your mouth. You want to place a nice seal with your lips. Don't block the hole with your tongue. You want to blow out as hard as fast as you can. Like you're going to blow a dart gun through a blow dart. So what we're going to do, big deep breath in, fast as you can. It's going to move this dial up and it's going to give us your number. So if you're ready, we're going to do this 3 times and we're going to get your number. Did you understand that?
Yes.
Okay. Sit up big and tall. Big deep breath in, fill your lungs, get ready. Blow it out as fast as you can. All right, great job. All right. So there's your first number. Okay, then you just shake it. Just kind of shake it and it goes back down. Give you a little minute to take a little break. Feeling all right?
Yes.
Okay, we're going to try it again. Get another number. Big deep breath in. Poof, shoot it out as fast as you can. Great job. That was even better. Shake it down again. You ready?
Yes.
Okay. Big deep breath in. Hold it. Blow it as fast as you can. All right. Okay, so there's our 3 numbers. So it looks like this is going to be our best number. So we're going to go with that. I'll go ahead and mark that number down for you today. As you can see on this little chart, there's the numbers. You just check off where you're at.
Okay.
And there's your days, AM or PM, check it off when you did it. And then you put your name up there. So we're going to do this for 2 weeks. We're going to take that back to your doctor's office. They can kind of track and see where you're at. So I'm going to give you all of this information. Do you have any questions?
No.
So this peak flow meter, after you've gotten your personal best down and we know what your goal is, just for regular use, if you start feeling tight, you know, like I said, blow it, it'll tell you where you're at. But for the first 2 weeks, you're going to do this every day, 3 times, so we can track and get your personal best number. Then after that, the doctor is going to be able to tell you where you're at. And I'm going to let you speak to the doctor again because they actually have a care plan for you, plan of action, that'll tell you exactly what to do when we're in these areas. I told you a little bit, green's fine, yellow take some more medicine, wait, blow again, maybe need some more medicine, red may need to go straight to the emergency room. But based on these outcomes, they may also want to increase your medicine. You may need to be on a daily maintenance medicine. We may need some steroids to help with the inflammation. So all this tracking information helps us know how to better medicate you and help better control your asthma. Do you understand? Do you have any questions?
No.
All right, ma'am. Well, thank you very much.
Thank
I'll let you
you.
speak to the doctor and go over your action plan. Thanks.
Thank you.
It's me again.
Nice to see you.
This won't take long, but I thought it was important for us to go over this plan of action here. Once you leave here, these are the kind of the things I'd like to see happen, okay? I understand that Wendy came in and talked to you about the peak flow device. You understand about the 2 weeks and monitoring that and making sure that you record everything, right?
Right.
Okay. From the standpoint of medications, what I'd like to put you on is Ventolin, which is 2.5 per unit dose. It is a bronchodilator. helps you expand your airways, okay? I want to use that as needed, and typically when you might need that will be if you start to have the onsets of another asthma attack. Just immediately use that. There's 2 puffs in it, and it should be acting very fast. They work in 5 to 10 minutes, so don't panic. It'll work pretty quick for you, okay? From the standpoint of a long-acting drug, a maintenance type of drug is what I like to keep you on for right now, and that would be Advair. We want to go with the 250/50 disc. Again, it's a medication that is a longer-acting but slower, slower reaction time, but longer-acting type of drug. It's a 1-puff disc. I think you've seen them on TV before. And you take that 1 puff twice a day. Usually do it in the mornings when you first get up, and right before you go to bed at night. What that does is that will keep those airways open, and it will allow you to sleep and hopefully prevent an asthma attack. That's the whole idea behind the maintenance type of drug. It just kind of keeps it pushed away. Right now you're on prednisone in the hospital. I want to discontinue that but put you on a Medrol dose pack, and as far as that goes, it's the same type of medication. It's a steroid that reduces inflammation in the airways. It keeps these inflammations from doing this to go out to there, so you can breathe a little bit better. What I want to do is the prescription is set for 6 pills the first day, 5 pills the next day, 4 pills the day after that, 3 pills the following day, 2 pills, and then 1 pill over a 6-day period of time. When you're done with that last pill, you're done with the treatment, okay? You don't have to renew it or do anything else. That, again, that is for the inflammation part of it there. Make certain that you take the doses as prescribed. If, for example, that you take 6 pills the very first day and you take 5 pills the next day, and then for whatever reason you get busy or something happened and you got called away from something, you forgot to take the 3rd day's pills, don't panic. Just start in on that 3rd day rotation the following day, and then just keep going until you taper down to nothing, okay? Again, it's a steroid. It's helped for inflammation, and it's not going to ruin you if you forget a day, but make sure that you follow it as best as you can, okay?
Okay.
All right. I'd like for you to schedule an appointment with your family doctor in 2 weeks. And the reason why I want it in 2 weeks is I want to see the results of what happens with your peak flow. Okay, so it's important that you bring that chart with you, that diary thing that you're going to keep with that, and show it to him. That gives him a good picture of how you're doing over the last 2 weeks, and it'll also help me determine the severity of your asthma and whether or not we need to prescribe other medications or continue on with the way we are, okay? Now, do you have any other questions of me or of our staff or anything else that I might be able to answer for you?
No, I don't think so.
Okay. You have my numbers. The nursing people came in and gave you their information right there. Again, contact your doctor if you have any problems when you're doing that peak flow device. I think they said something about in the red. If it does stay in the red and you've tried a treatment and then you stay in the red again, by all means call your doctor. He will either recommend that you come into the emergency room or he'll recommend something for a quick fix for you, okay? If you're not satisfied with that, call over here. I'll get the message and I'll call you back, okay?
Okay.
All right, Betty, that's all I have for you today.
All right.
Thank you for your
Thank
time
you.
and good luck to you, okay?
Thank you.
Okay.